Good evening, all. On behalf of HITcon, I welcome you all on this HITcon Hit Talk. As we all know, on this platform, we invite various health tech experts who talks about various useful things for doctor and healthcare professionals. Today, we have got a distinguished speaker with us, Mr. Bhruguraj Trivedi. Welcome, sir.
Sure.
Bhruguraj Trivedi, sir, is Joint Director IT, Ayushman Bharat Digital Mission Gujarat. Today, we'll be talking about the much talked and much discussed topic in the healthcare fraternity in today's time about healthcare professional registry, that is HPR. Today, we'll be discussing about the various aspects of HPR, what is HPR is all about, and why one should register. Is there any advantages of registering, and this and that. So, without much ado, I will invite Mr. Bhruguraj Trivedi sir once again. Welcome, sir.
Thank you, Dr. Pragnesh. Thank you so much for inviting me. On behalf of the entire setup of Ayushman Bharat Digital Mission, Health and Family Welfare Department, Gujarat State, I'm very thankful to you, sir, for arranging such a wonderful interaction and the platform for the health fraternity. I'll start with the basic requirement of what the Ayushman Bharat Digital Mission is.
Yes, sir, please.
We have been some very tough times in recent past due to the pandemic, where we felt that we should have access to the health records of our patients, so that we would be able to have their data available. When we talk about the left behind, so again, how we can link the health with the digital India, that is also the one perspective. When we talk about the digitization, say for example, when we start from the financial sector, it has migrated or it has matured up to the QR code, the UPI. When we go to market and we just scan the QR code and payment, maybe to a vegetable vendor or to a tea vendor, or say for example, if we go by an auto rickshaw or a taxi, we just scan the QR code and make the payment. We don't know the vegetable vendor or the tea vendor or the auto rickshaw driver, but it is so much convenient. It is so easy to use that you can just scan the QR code and make the transaction. So based on that technology, with the maturity in the technology, why don't we have that sort of facility where the citizen can scan the QR code of, say, for example, if I'm visiting Dr. Pragnesh's clinic, I can just scan the QR code of your clinic or your QR code, and I can share my personal health records, digital health record with you. So that would be a tremendous shift, where the citizen would be the owner of the data, and he would have the right or the choice to share the data. Say, for example, I may have multiple records with me, but I have the choice to share the data with you. So Ayushman Bharat Digital Mission is such mission where it brings all the stakeholders on a common platform, be it the citizens as patient, be it the healthcare professional, maybe a general physician, MBBS, maybe a super specialty doctor, or say Ayurvedacharya, or homeopathy practitioners, or say the nursing staff, or the last mile are medical stores, the pharmacies. So everybody would have access to a common platform. A doctor may write a prescription. It may be shared with the patient may pass it on to Jan Aushadhi Kendra or to the nearest pharmacy and can get the medicines from the pharmacy. Or say, for example, if you prescribe a lab report or an x-ray report, the same may be shared with the consent imagery center, and they can in turn share the reports or image digitally to the patient, and same may be shared with the doctor subsequently. So entire cycle is seamless, it's paperless, and it's very easy. I don't need to carry the physical documents with me. Say for example, I'm staying in Gandhinagar right now. I may travel, I may get transferred, I may go to say Ahmedabad, or I may travel to Surat. I don't need carry those records physically with me. So it's very handy. It's very easy. And in today's time, it's very adaptable. The epidemic has helped us a lot. We are also very open to accept the technologies, and the technology will also help us in providing better services to the fellow citizens with the help of the technology. So that was the base that why the Ayushman Bharat digital mission is there. So the crux is the citizen is the owner of the data. So citizen would give the consent to Dr. Pragnesh to access the data. It's not that I've just scanned my document and linked it with my number. It would be available to each and every person on the internet.
Okay. So you mean to say basically healthcare professional registry is the official listing of entire healthcare system, all the healthcare professionals, starting from base to level to the super specialist and as well as the patients. So they all will be joining on the similar platform, on a single platform.
Absolutely. There are basically 5 building blocks of Ayushman Bharat digital mission.
Right.
Namely, the first one is Ayushman Bharat Health Account, ABHA. It is popularly known as ABHA.
Yes.
It is a unique health ID of each and every individual, each and every citizen. It is applicable to me, it is applicable to you, or it may be applicable same way to a person or a vendor at a hookah. So there is no constraint or there is no limit as far as the income is concerned, as far as the gender is concerned, as far as other demographic parameters are concerned. It is inclusive of all. It is a sarva samaveshak for everyone. So
Right.
that is the Ayushman Bharat Health Account, where a citizen can link his or her personal health records (PHR) with that Ayushman Bharat Health Account. The
Right.
second one is the Healthcare Professional Registry, the HPR. It is known as. So HPR, it is for the healthcare professionals. It may be a general physician, homeopathy, or from any system of medicines. They can register on HPR. It is applicable for the nursing staff as well. The third one is for the facilities. We have talked about the citizens, we have talked about the healthcare professionals. Now it talks about the facilities where the healthcare professionals are working. It may be a smaller clinic that we found nearby our households. It may be a mid-sized nursing home. It may be for the super specialty hospitals as well. It is applicable to the labs as well. So these health facilities, they register under the health facility registry, HFR. The fourth aspect is the UHI, Unified Health Interface. Now, different institutes may have different IT systems. It's very obvious. So, the basic objective or the unique feature of this entire system is the interoperability. The IT system deployed at Dr. Pragnesh Vachrajani's clinic should communicate with Dr. Chawda's clinic in Surat.
Right.
So that interoperability would be possible through the help of Ayushman Bharat Digital Mission, the UHI, Unified Health Interface. The open APIs would allow the exchange between two different systems, or a lab may be able to share the data with Dr. Vachrajani seamlessly. So that APIs would enable that. And last part is the ABHA application. The ABHA application, it is available on Play Store and Apple Store. It is very simple. A person as easily uses WhatsApp can use on very similar way the ABHA app as well. ABHA number, one can register the ABHA number and can link the health records with ABHA. One can upload the documents on the DigiLocker or the health lockers available online, and subsequently can share with the healthcare professional and health facilities. Now, as we share the location through WhatsApp, the same way we can easily manage the consent with the doctors or the health facilities. We can give consent, we can revoke the consent as well. So it's very easy. It's not that we have given the consent to a professional HPR or an HFR. It is infinite. We can always review the consent given to any institute, to any professional, and we can revoke the consent as well. Now, when we talk about the ABHA, how we can generate Aadhaar. There are two methods of Aadhaar number. In driving license, you can key in your driving license, and then you can visit the nearest government health facility, and you can get Aadhaar generated through assisted mode at the government health facility. That is method one. The method two is through Aadhaar number. You can visit the Ayushman Bharat Digital Mission website, the Aadhaar page. You can key in your Aadhaar number. If your mobile number is registered, you have to authenticate yourself, you have to key in the OTP. It will not take this much time, it will take even lesser time than that. It takes 35 to 40 seconds to generate the Aadhaar number. It is as simple as that. It's very easy, and
Okay.
it
So,
is G.
yes, sir. Please go ahead.
So it is very easy, and one can generate it very easily. It's simply like UPI. You can scan the QR code and you can key in the Aadhaar number, and it will give you the Aadhaar number. You don't need to key in your name. You don't need to key in your date of birth. You don't need to key in your address or mobile number or registered email ID. If these are available in the Aadhaar number, it will fetch from that.
Okay. So you mean to say, sir, that if I am using an X company software and you are using a Y company software, and if our patient interchanges, then the this unique system interface will fetch data from either of the system if the patient gives the consent.
Yes, if the consent is given, yes, data may be shared. The consent is the key.
Right.
I'll share my example. Yeah, please
Yes.
go ahead. You are asking something.
Yeah, no, yes, sir. Please go ahead.
I'll give my own example. We have been testing in various systems in Gujarat. We were part of a review team to visit one of the state, and in the southern part, and we went there in the remotest area. I myself participated, volunteered in one of the clinical assessment, and in the teleconsultation, I was, as a patient, I represented myself, and I gave my Aadhaar number, and the details. When I gave my consent, I linked my certain documents of the personal health records with Aadhaar. So that documents were available at the time of teleconsultation to the doctor who was sitting in the medical college of that state. So it's very much possible, and it is visible after my consent only.
Okay. So, if I, as an individual, let's not talk about hospitals first. The advantages of my being registered in the healthcare professional registry is universal access to the database of the patient. Whenever patient comes to me, and whatever states or maybe cities he may be visiting, I can have access to the data.
Absolutely.
At the same time, being registered in the healthcare professional registry, I am also visible on the government listing that my clinic or hospitals is here, and I can list my facilities and I can publish my facilities too, right?
Absolutely, sir. I'll add on to that, or rather, I would start from there. Sir, the first one is the trust and reliability. In the Ayushman Bharat Digital Mission model, there are multiple checks and balances. So, if Dr. Pragnesh Vachrajani applies for the healthcare professional registry, it's not that once you have registered, your application will get approved. No, the application will go to the Consent Medical Council. The medical council will check against your application. The HPR application captures your demographics, like your name, your registered address, your telephone number, date of birth. Then it captures your educational qualification, like your registration number, your degree certificate, the dates, then your working experience. So medical council verifies your credentials against the database that they are having. And if they found any discrepancy, they will raise an alarm. They will flag the query, send it back to the applicant, and the applicant has to give the response. Once they are satisfied, then only the application would be approved and it will go to the universal database.
Right.
So first is reliability. It is a reliable source. The second is, of course, the visibility. Now, if I check that the physicians available or the doctors available in Ahmedabad city, I'll get name, say Dr. Pragnesh Vachrajani. So I'm assured that the name available in the database of ABDM, it is the trusted name, and it's a qualified. He is a qualified professional. So we have more than 3 crore Abha generated. So citizens have registered already in ABDM, and more than 30 crore have registered across the country. Now it is available on the internet platform, so it is accessible to everybody. Anybody can search on ABDM platform that how many or who are the practitioners practicing in Ahmedabad. So it will give access to that much of citizens. So you have better visibility. You have the trusted banner like the Ayushman Bharat Digital Mission. And again, yes, there is the improvement in efficiency. We have, of course, the personal health record of citizens available with the consent of the patient. So when we are diagnosing the patient, we are in better position. We can always give better qualitative treatment to our patient with minimal time.
So I think what I would recommend to my colleagues is forget the interoperability and other things that you talk about. First of all, it gives you a recognition as a recognized healthcare professional, because the biggest threat that we doctors face today is being recognized as original. So I think that will definitely give us the much needed authentication from the government of India itself that he or she is a recognized doctor. That's why they are listed on our platform. So I think that is one of the biggest reason I said I think everybody should be registering on the this healthcare professional. Thank you, sir. There is one more thing that if what about hospitals, the bigger setup? Now we have got a lot of corporate hospital, 50-bedded hospital, 100-bedded hospital, 500-bedded hospital. So does it operates the same way as for the individual doctor, or this is something different?
As there is a registry for healthcare professional registry, it is similarly we have a health facility registry as well, where the facility needs to register with the ABDM. Now, what data or the parameters it captures at the time of registration, the facility manager needs to initiate the application. The facility manager means one may be an administrator or one may be a healthcare professional. Right. One needs to have the HPID first. It's a prerequisite. Second thing, when one's login with the HPID, one can log in with either OTP, mobile OTP, or Aadhaar OTP, or password, or if email is verified, the OTP may be sent on email as well. So you don't need to worry about the password. You can log in from any method. You can use mobile OTP, Aadhaar OTP, mail OTP, or the password, of course, there. Now, in the application time, the demographics of the facility manager is retrieved from the HPR registration. Then it captures the demographics of the facility, like the name of the facility, the address, the mobile number, website if it is available, the address and all typical things. Then you can pinpoint the lat and long on the map. As we map on Google Map, or when we book the cab through the mobile app. Similarly, we can pinpoint on the Google Map, so it will give the exact precise location to the citizens. Now, moving forward, it talks about the type of medicine it operates in. Maybe say, for example, it is in modern medicine. So modern medicine, what sort of facilities are available, whether it is just the general practice, or say, for example, it is of cardiac, or say neuro, so on and so forth. Another thing is whether it is an OPD, just OPD or IPD, whether it has the blood bank, whether it has the pharmacy available, the ICU available, then on what days it is available, what are the timings, whether it is 24/7. So there are multiple things. I forget about as an administrator or part of the health facility. Now, as a citizen, what sort of queries or the details I may require if I search? If I'm new to Ahmedabad and if I want to search something about, say, for example, I'm having some trouble with my head or with my eyes, what sort of details I would search for? Or within the city, if I want to address the queries or difficulties, what sort of parameters I would look as a citizen for a certain hospital or nursing home. So all those details are captured. Now, again, as I mentioned for the healthcare professional registry, similar setup is there for the health facility registry as well. We have multiple levels of verification. We have the facility manager is nominated from the health facility because the facility manager knows the facility well. facility manager submits the data, it goes to the district verifier. District verifier verifies the data, because district verifiers, it may be multiple district verifiers may be there. So district verifiers, they are used to visit multiple hospitals under various schemes and various rules and regulations. So they are aware about the locality. So they verify the data submitted by the facility manager against the various checks. And then once the application is verified, it again goes to the district approver. And district approver looks at the details, and once the district approver is satisfied, then only the application is approved. So there are again multiple layers of approval, verification and approval. So it is layered, it is assessed, and then only it is approved. And again, as I would say, that it has the visibility, it has the credibility of ABDM. And when the citizen searches for a particular sort of requirement, he will get every detail that he's looking for at a single point. So that is again the benefit of that. Now I will give you one more example. I'll narrate my own example. Now, if I am visiting any nursing home, say for example, a larger hospital where a token system is there, registration is there. Now, my name is a bit difficult to understand and to type. Bhruguraj Trivedi. So if I visit any hospital, the data entry operator may not be comfortable with the name, so he'll ask for a few times. So in the beginning of the day, it is quite okay, it is accommodative. But as the day progresses, it becomes difficult, and due to the fatigue, also the data entry operator may make some manual mistakes, typographical errors. So Bhruguraj, BHRUGURH, it may happen BHRU or Raghuraj, something like that. The name may go. So the human intervention is there. Then you will have the typographical errors. We are having a feature in Ayushman Bharat digital mission, scan and share. So if I visit a hospital and if there is a QR code available, I can just scan the QR code and I'll get the token number of that hospital, of that OPD. And my details, my demography would be available at the OPD registration counter. So the data entry operator is not required to key in any details there. And that details, the demography of Bhruguraj Trivedi, personal health record with my consent is available there. Now, when I go for the clinical assessment, my personal health record would be available at the physician test. So the physician would also be in better position. He knows whether the Bhruguraj Trivedi who is going to visit the chamber in few minutes, whether he is suffering from blood pressure, or is suffering from sugar, or he is having thyroid, or he is allergic to any medicine, or he has gone through any surgery, so on and so forth. Every medical detail that the physician would require would be available at his fingertip. So it is a tremendous help for the clinical assessment. So the doctor would be in better position when the patient comes and visits for the opinion. So that is again a great benefit. And when we talk about the administrative aspect, the manual intervention is reduced from data entry to the discharge, and from discharge to the mediclaim process, TPA. Entire cycle is seamless, it's paperless. So the administrative or operational issues are minimized. So it will have great impact on efficiency. It will reduce the issues and bottlenecks, and overall it will have wonderful multifold effects on the operational aspects as well.
Thank you, sir. So I think it looks very exciting and very promising, and I think maybe in coming time things will see. I particularly like this point of avoiding administrative errors, because there are plenty. And in healthcare, we need to be very, very particular about the patient name and the history that we capture. And that is again wonderful that it reduces the time and procedural delays on the part of the healthcare professionals. So that's what we always look in when we start using technology. We always feel that technology should help us in reducing the time for non-productive work rather than help us in getting more productive work. So that looks useful. That looks exciting. Sir, tell me one thing: how one can start this journey of registration of as an individual and as the healthcare and the facility registry also. How to start about it? How to go about it?
Sir, one can visit the Ayushman Bharat Digital Mission website, abdm.gov.in. There are sections of Ayushman Bharat Health Account, ABHA. There is a section of HFR and HPR dedicatedly. On clicking on the respective section will lead to the HFR and HPR. For healthcare professional registry, as I have said, you need to keep your registration details, medical certificate, graduation details handy. If you have the details available with you, photographs available with you of this, you would be able to register within 2 minutes. You need to you can generate your HPID, healthcare professional ID, with the help of Aadhaar number. It is similar to the ABHA process. You can key in your Aadhaar number. It will give you the OTP, authenticate yourself, and your HPID is generated. So your photograph is retrieved from Aadhaar. Your demographics are retrieved from Aadhaar. Then you need to key in your registration details and degree certificate details. You need to upload those documents as well. Then you need to upload your work history. If a government professional is there, we have another check. It would be checked by the government nominated officer. For the healthcare professionals, private practitioners, it would go to the medical councils, respective medical councils, and respective medical councils will verify the details. Acha, one more thing. If you don't want to keep your photograph visible to the common public, or if you don't want to have your mobile number available in public domain, you can just untick that. So there is a facility available that you can keep certain details confidential or private from the public domain. Similarly, for the health facility registration, you have to visit the HFR page. And in the HFR, you need to upload 3 photographs. The front facade of your document with the board or the visibility of that clinic or the health facility. One is of the facilities overall photograph, and one is for the address proof. You can upload the light bill, say for example, or if it is a rented property, you can upload the rent agreement, something like that, to verify the address. So these 3 photographs, if it is available with you, within 3 to 4 minutes, one can register the health facility registry as well online. It's very easy. ABHA, as I have narrated, it takes less than 30 to 35 seconds to register ABHA as well.
Do you see in future that something will come that whomsoever patients are coming to me, maybe I will be able to generate ABHA from my system itself rather than they do themselves?
In the HMIS, Hospital Management Information System, if you are having an ABDM compliant system, with the consent of citizen, yes, of course, you can generate the ABHA from the system itself. It is very much possible. Right. I'll share the example of government systems. We have recently opted for e-hospital HMIS, where we have the option to generate the ABHA number of the patient. Where the patient is not having the ABHA number, we can generate the ABHA number at that time only. It's very much possible, sir.
Okay, so that serves a dual purpose. Patient gets the ABHA number, as well as the data sharing automatically started happening between the regular patients and this. Fine. Absolutely. So what level of expertise do we expect the doctor or healthcare professional to have to register on this platform? They need a special laptop and this and that, or only via
sir, through mobile also, with the routine mobile that one is using, we can register ourselves. Even if you are commuting, you are on move during the movement, also commuting also, you can register yourself. There is no issue.
Okay, so I think as sir, you rightly narrated everything in quite a detail, that I think I do not find any reason that why any healthcare professional should not register themselves and generate their individual this healthcare professional registry and as well as their own healthcare professional ID on the ABHA network. And I think the future looks very promising. And as sir has rightly said, just keep your degree certificate, which proves the degree that you are having, the place where you are practicing, the geographical location proof that you need, photographs of yourself if you are registering as an individual, and photographs of your healthcare facility if you are registering your healthcare facility. And I think I have already registered, so I have got a seamless experience. They need to, yes, sir, as lightly said, less than 5 minutes to generate and to register my healthcare facility. That was really seamless. So I think, thank you, sir, for elaborating things in quite detail. And as I said, the things look very, very bright, and the future looks quite connected, because as of now, we are dealing with a lot of, we can see still patients moving with bunch of files from one hospital to another, because nobody talks, no system talks to one or the another. So interoperability, I think, is the key. So is there any reason to worry about the security of the data, the cloud breach or something? Is there any chance that we healthcare professionals should worry about this? Because in the end of the day, if something leaks from our side, we will end up in soup.
Absolutely, sir. It is a very valid point, and many people have this anxiety and question that what is about the data, because ultimately it's all about the data.
Yes.
Sir, as we are seeing in various events on various platforms, forums, that but the relationship between the doctor and the patient, it's based on a trust. So the details shared between the patient and the doctor remains between the two entities. So the ABDM is built on the three principles. The one is the privacy, confidentiality, and the security. So these are the basic guiding principles, and the utmost care has been taken. The global standards of the security has been followed, and the instructions and the updates given by the government of India from time to time, it is other accommodated, and it is evolving. It's not that it's once set, it stays there. It gets evolving every day as there is improvement in the technology. We are accommodating those changes, and it is federated structure. It's not that everything, all data is captured, or it is migrated from an individual to government of Gujarat or government of India. It's not that the data is consumed by the federal agencies. It is a federated architecture. The data remains where it gets originated. So it is absolutely secure. There is no one should not worry about that, and it is based on the consent. Again, I'm giving emphasis on the consent. If I, as a Bhruguraj Trivedi, gives consent to Dr. Pragnesh Vachrajani, then only Dr. Vachrajani will get access to my data. So
Okay.
it is absolutely the citizen is the owner of the data. It stays with the citizen. Neither it stays with the ownership doesn't stay with either with the healthcare professional, nor with the health facility, nor with the government as well. The citizen is at the center, and the citizen owns the data. So that is the basic difference, or the basic beauty of the ABDM that we are having. Many other countries, they have adopted for the digital health system, but you must have also heard and come across that the details are not shared with the citizen or the patient, who are actually the owner or the consent with the details. It's not shared with them. But in India, with the ABDM, the owner of the data is citizen. Citizen owns the data and decides whether he wants to share the data with the physician, with the healthcare professional, or the health facility or not. And again, once the consent is given, the citizen can always review the consent and can revoke the consent as well.
Right. So it's not that the consent is given, they stays for lifetime. It can be always be revoked.
Absolutely, sir.
Thank you very much, sir, for sparing your valuable time. And I think we have taken care of you've taken care of almost all the questions that our viewers has. I think so. Thank you, Bhruguraj Trivedi, sir, once again for joining us today on behalf of Ayushman Bharat Digital Mission. And thank you, viewers, for joining us today on the HITcon Health Tech this YouTube channel. I request you to please stay connected with us and do subscribe to our channel for getting updates on the latest topic. If something new arises and there are some new sort of questions, we'll definitely ask sir to come and join us again. See you then. Thank you very much. And
thank you.
I will request on behalf of Team HITcon, I will request all of you at least to just today itself get yourself registered with this Ayushman Bharat Digital Mission. Thank you.